Good afternoon, everyone, and welcome to today's webinar, Establishing Partnerships, Connecting Head Start and Community Colleges. I still see several folks signing in, so we are going to give them one moment to get into the queue. And so before we begin, as we're waiting for everyone to sign in, I'll just do a few quick administrative announcements. If you have questions throughout the webinar, please put them in the Q&A chat. We also will be using the chat to share live links throughout, and the slides will be available after the webinar. So you will have access to everything you are seeing today live during the webinar and available to you afterwards as well. So with that, I'd like us to officially begin. Hello, my name is Carrie Warwick-Smith. I'm Vice President for Public Policy with the Association of Community College Trustees. Today's webinar is Establishing Partnerships, Connecting Head Start and Community Colleges. And I'm joined today by my colleagues at ACCT, the National Head Start Association, as well as the ECMC Foundation, to share the results of the work that we have done over the last 6 months. Next slide, please. So just a quick overview of the agenda. We're going to start with introductory remarks from the ECMC Foundation, and I'm going to do a quick framing of the conversation to give an overview of ACCT and NHSA's work in this project. Then I'm going to turn it over to my colleagues, Steve Jerch, Director for the Center for Policy and Practice here at ACCT, to talk about lessons learned. Then to Victoria Jones, Senior Director of Data at NHSA, and Sean Robbins, who is Project Associate here at ACCT, to talk about the Kids on Campus User Guide, which is the culminating piece of work that's come out of the surveys and focus groups and meetings and resources that we have collected over the last 6 months. And then I will close it out with a few notes on what's next, and we can take any questions. So as I said at the outset, these slides will be available. We will be using the chat to share live URL links if you would like to download the materials as we go, and the slides will be available along with the recording of the webinar by the end of the week. So with that, let me please introduce Amber Angel, who is Program Officer at ECMC Foundation, and who is the lead funder on this initiative. Amber, and next slide, please.
Thanks, Carrie. Hi, everyone, and happy Wednesday. I'm very excited to be with all of you to see these slides and learn more of what phase 2 could potentially entail based on all the hard work the last 6 months to do this kind of landscape analysis. We know, as Carrie mentioned, I'm Program Officer at ECMC Foundation, leading our Single Mother Student Success Initiative. And as you know, we know through research, if you're here, that supporting student parents benefits all of us. Beyond investments in single mother students being in the tune of billions of dollars of tax revenue increase, to the fact that student parents on average have a higher GPA than their non-parenting peers. We know that still, despite all of these motivators of children being motivators, that only 11% of single mothers who enroll complete an associate's degree within 6 years. And childcare is one of those biggest barriers for accomplishing a degree. I just anecdotally want to mention, I was in Texas yesterday with the Trellis Foundation to learn about how are these colleges going to implement these new legislative bills that passed mandating student parent data collection, which is so exciting. But just because a bill passes doesn't mean that we know how to implement it. And so what ACCT and National Head Start are doing, and why this project has been so exciting, is that although we know childcare is a really big barrier in completing a degree, how do we provide that childcare? What does that look like? And so, I'm excited to be here. I'm excited to hear from them, and I'm looking forward to the work ahead.
Thank you so much, Amber. And we greatly appreciate the support of ECMC Foundation and the Single Mothers Initiative, as well as the Selding Herring Smith Foundation, which have joined together to support the first phase of this work. So moving into framing the conversation, as Amber shared, we know that childcare is a basic need for parents, working parents, and particularly for student parents who are usually also working parents and need that childcare support so they can both work and further their educations as they pursue their careers. So about 6 months ago, ACCT and NHSA came together to see how we can create a catalyst in the really across the country to increase the number of Head Start programs that are located on community college campuses. Our estimate is that there are currently about 100 of these partnerships, but with well over 1,000 community college campuses and over 17,000 Head Start sites nationwide, we believe that this is a solution that's beneficial to the college, to student parents, to Head Start, and to Head Start parents and staff, and that we can help fuel the increase rapidly of those 100 partnerships. So our long-term goal over the next 5 years is to work with as many campuses and Head Start programs as possible, with the hope that we will launch at least 75 co-location partnerships over the next 5 years. And over the last 6 months, we built resources and the beginning of a roadmap to help those partnerships streamline the process. And so today, we're going to share some lessons learned throughout the last 6 months of talking to folks who have partnerships, who would like to have partnerships, who tried to build partnerships and may have hit some roadblocks, as well as the resource guide that our outreach meetings, site visits, and research have come together and to today's publishing and sharing with all of you. So with that, I am going to turn it over to Steve Jurch, Director for the Center of Policy and Practice here at ACCT, who's going to talk about the lessons learned. Steve?
Thanks, Carrie. As Carrie mentioned, one of the ways we got this information on, if you could advance, thank you, Sean. The way we gathered this information was through some focus groups. We figured the best way to learn more about this project or this issue was to actually talk to the people that are actually doing it, who have tried to do it, who want to do it, and then talk to those people specifically that this would impact the most. So we gathered information from 4 different focus group categories. Some of them were combined, both community colleges and Head Start, but then some were done separately with both organizations holding their own focus groups. So we mentioned, we talked to successful partnerships. We talked to partnerships that we're calling roadblocks partnerships. We talked to organizations that wanted to have partnerships, and then we spoke with both community college student parents and also Head Start parents. And the information, we learned a lot, and then a lot of it you'll see reflected in the resource guide. But the good news is that we really didn't hear anything that was a huge surprise, based on our backgrounds and other conversations that we've had. All of these issues or all of these, processes were nothing that was too large to overcome. So nothing was a real big surprise, but some of the main takeaways as far as some of the benefits that we learned were, the first one we talked about was just how important it was to the success of parents to have this resource. Amber mentioned, this is a major barrier for a lot of students. And, while we know that there are other barriers involved, this seems to be one of the larger ones. And so it was very validating to sort of hear that in real time about how important this resource was. The other big thing, as with any large initiative, whether it's at the Head Start locations or at a community college, senior leadership support was key. It's amazing what can happen when the president of a community college just says, this is what we're going to do, and I'm going to dedicate resources to doing it. So, we heard that over and over again. And so, part of our strategy is to make sure that we have all of that leadership buy-in moving forward. Another thing we learned is around that Head Start is free for eligible individuals. One of the challenges we heard with community colleges was that it's expensive to have these types of centers on campus. And so the fact that Head Start has funding that's available for its participants, so it's free to the children and to the parents, was a huge key to its success. And what we're hoping for is that those Head Start centers, when they are located on a college campus, provide that anchor institution or that anchor organization, so that the community college can then potentially expand childcare using other funding streams. One thing we also saw was that it wasn't just beneficial to the student parents, it was also beneficial to students in some of the academic programs. And so we learned that, a lot of these partnerships use those Head Start locations and other Child Development Center classrooms as a site for observation, for practicum and student learning or student teaching opportunities with their early childhood education programs, but also programs like nursing would come in and do health screenings. And we saw, dental students would come in and do health screens as well. And so there's a lot of tangential opportunities with these partnerships that will benefit more than just the actual students, student parents and their children. And the other advantage I think that we saw with Head Start specifically being on campus is that Head Start is more than just childcare or pre-K or something along those lines. There's a very specific curriculum that goes along with Head Start. And in addition, it's not just for the children, it's actually there's resources that are provided for the parents, including education resources, health resources, family stability resources. So it's more than just what you may consider childcare or pre-K or something along those lines. So it's much more comprehensive, which provides a lot more support for the students. And then finally, we saw that there was, opportunities to create partnerships to help with workforce development needs for both early childhood education teachers, but also other tangential services that are associated with running a center on campus. So things like providing financial resources for employees of Head Start to go get their certifications, or to provide a working environment for a recent graduate, those types of things, because what we found was a lot of the vacancies in Head Start are due to the workforce shortages and not because there's lack of space. So with every good success, there are always challenges. So some of the other things that we learned around barriers to partnership, but we knew there were going to be barriers to everyone to this, or else everyone would be doing it, right? Carrie mentioned there are only about 100 of these partnerships that exist in the United States. And we found out through some of our conversations that this idea of partnership between community colleges and Head Start centers has been something that's been discussed since the 60s. So it's not a new concept, but if it was easy, everyone would be doing it. And some of the things we heard from the focus groups was that, one, it was fantastic that none of these barriers that we learned about, that they brought up, that they were discussed in these focus groups, nothing would want to stop them from moving forward with the process. So it was very obvious that the benefits outweighed the barriers. But what we did find out was that a lot of it came down to, an initiative of this scope is a large undertaking. And so a lot of the institutions and the facilities did not have the capacity to take on this large initiative with all the other things they had going on. So it really demonstrated the need for some sort of resource and technical assistance and some guidance in this process, because they really want to do it. They just didn't know where to start and didn't know how to proceed effectively. So some of the main barriers that we heard coming up in some of our focus groups were, there's this question of liability, like lack of understanding of who holds what liability. What is the college on the hook for? What is the Head Start Center on the hook for? So just some conversation around that, or some guidance around that would be very helpful for that barrier. The other one was logistics. Now, if you've ever tried to align two large bureaucracies, that can be challenging. So understanding that, college schedules maybe need to be adjusted. The Child Development Center hours may need to be adjusted. So the schedule, are there other student supports that get wrapped into this? So some of the operational logistics of the campus may need to be adjusted in order to align with the Head Start Center. Some of the other things were that, student eligibility was always a big issue. We got a question over and over again around how are the institutions going to prioritize the students that participate in Head Start versus other childcare opportunities. So not all students are going to be eligible with Head Start. And so that is a challenge or a barrier that we recognize is how the institutions that want to prioritize. There's going to be more demand than there is supply. So we recognize that from the get-go. So some of these things are going to have to wait until the partnerships are able to scale up a little bit more to help meet that increased demand. The requirements around Head Start can be complicated. So, understanding what has to be incorporated into the facility or into the operational modification, who has ownership over those types of requirements. And then we mentioned this a little bit earlier, but aligning the timeline. So is there construction that needs to happen? When is the Head Start need to relocate? All of these timing issues have to be aligned, academic calendars, class schedules, those types of things. So like I said, none of these things were so daunting that the participants were like, nope, we're not even gonna even bother with this. But there are barriers, and hopefully we've created some strong resources to help get over them. So what I want to do now is turn it over to Sean, who's our project associate on this, to talk a little bit about some of the aspects of the actual resource guide we created.
Thank you, Steve. So in taking in mind the benefits and the barriers that we learned from the current partnerships, roadblock partnerships, and institutions and Head Start programs that are interested in partnering, we were able to culminate with the Kids on Campus User Guide. The Kids on Campus User Guide is designed to support community colleges and Head Start programs in connecting, negotiating, and launching a successful partnership. Although each partnership is unique, the partnership process for each on-campus Head Start and community college partnership follows the same primary steps. My colleague Victoria and I will highlight elements of the user guide, but there is much more to dive into with the Kids on Campus user guide. So at the end of the webinar, we will share how you can access this new toolkit. Ultimately, the guide is divided into 4 sections. The first is the before you begin. Prior to initially reaching out to your counterpart, it is important to understand what this partnership entails, how your future partner's business operates, and what benefits you hope to create by working together. This section of our guide provides an overview of what these partnerships could look like, as well as an overview of how both organizations are structured. Next is the partnership profiles. As was previously mentioned, every partnership is unique, and some may look and operate entirely differently from just one that's right down the road. In this section, we have written up descriptions of several existing partnerships from across the nation to help you see what is possible and what might be a good starting point for yours. These profiles are intended to serve as a starting point to crafting your own ideal partnership. Then we have navigating negotiations. Going through the negotiation process is the most detailed part of setting up these partnerships. You'll need to build relationships, answer some difficult questions, and finalize the legal components of your partnership before you can officially get up and running. This section of our guide will help you run through a list of questions you'll need to answer together. There's no right or wrong way to set up these partnerships, but you'll have to end up on the same page. Finally, launching your partnership. Once negotiations are complete and you've signed on the dotted line, your partnership has officially begun. However, there's still a lot that goes into a successful launch and ongoing partnerships. In this final section of the user guide, we have provided resources around marketing materials that can support recruitment of children and families, as well as potential staff. Additionally, we provide insights on various college departments that could engage with Head Start to enhance your work together. So let's dive into the user guide. The Before You Begin section helps establish the framework for partnership. To make these partnerships a reality, we ask community colleges to offer free or low-cost on-campus facilities to Head Start programs. The Head Start programs will use their expertise and federal funding to run the program, either independently or in partnership with another child care provider on campus. Each institution needs to be clear on its own capacity to partner and the value it brings to the table, as well as what it expects from its partner. Therefore, we provide an overview of Head Start and an overview of community colleges. While each community college and Head Start program is unique, we provide a general staffing structure for each, as there can be multiple individuals that can interact with the partnership to get it set up for success. For Head Start programs and community colleges that are interested in partnering, the user guide highlights things we recommend you know and or consider before starting the conversation. I'll get to that in just a moment. But finally, the before you begin section concludes with talking points for both Head Start and community colleges to help convince your local counterpart to establish a partnership. This includes talking points on the benefits for the Head Start program, children, student parents, and the community. We have created a before you reach out for both Head Start and community colleges. This element reviews questions that each potential partner should ask and answer for themselves. Questions such as, what value do you see in partnering to offer on-campus services, and addressing the timeline for partnership and availability of space on campus. Also, we highlight here best practices that can be leveraged to help start the conversation with your Head Start or community college. I'll now turn things over to Victoria, who will share more about the user guide, beginning with the partnership profiles.
Awesome. Thank you, Sean. All right. So because we're not really proposing something brand new here with these community college Head Start partnerships, but rather lifting up some really amazing possible partnership opportunities, that we think is not used enough throughout the country, there's some really great examples for us to draw from. And so we've included those here in the toolkit. What we've included so far in the toolkit are 4 partnership profiles. So essentially write-ups describing 4 different on-campus partnerships that already exist around the country. And each is really unique in the way that the program is structured, but can give a really great model or jumping off point for those who are looking to craft a new partnership from the ground up. So for example, one possibility is to have a Head Start program really run an entire child development center on campus. So that would include Head Start and early Head Start services, but also using additional funding sources like state subsidies, some of the other like state pre-K programs, even some private pay funded models, blending those all in together to serve families that aren't eligible for Head Start, all in one building. Another option is to just have Head Start run a couple classrooms within a larger Head Start or within a larger child development center that's operated by somebody else on campus, but Head Start can come in and really be running those couple of classrooms to support the families that need it. And so these profiles, as we've written, we've got the 4 of them, are intended really just to serve as a starting off point and help new potential partners see what some of the options are, identify which of these is way off base, which of these might actually work to start kind of as a groundwork, and then build their own unique kind of partnership model from there. There's much more to come in phase 2. So we're hoping that we're going to kind of continue adding additional examples, and also continue building out some of the information here, with more information as needed based on what we hear back from those who are starting these partnerships. So next slide. And then really the densest chunk of the user guide, I think, is really the navigating negotiations section. And this section really covers from the time when a college and Head Start like agree to partner and say, yeah, let's start working this out, all the way up through actually like breaking ground on building a new building and throwing open the doors and getting children and families into the center. And so the center works through all of those different kind of pieces that they'll need to address as you're kind of negotiating and crafting a brand new partnership. So everything from negotiation topics you're going to have to figure out, a checklist to help you prep for actually having an MOU or contract. We've provided a couple sample contracts, one that's really in-depth and detailed and one that's much more kind of high level. And then a guide to figuring out kind of what retrofit costs might need to happen, how federal interest comes into play, et cetera. So looking a little bit further into those, next slide, is the important negotiation topics, because there are several critical questions that partners are going to have to answer, and all of them are way more complicated than just a yes or no question, or yes or no answer. And they are also questions that really don't have right or wrong answers, right? Just things that are going to either meet the needs of both partners or not. So for example, how is a program going to address eligibility? Head Start has really specific eligibility guidelines, and not everybody who's going to want to use the on-campus child center, as Steve was talking about before, is going to be eligible. And so there's a question around blending and braiding other funding, having other operators in the building who are able to support families who are not necessarily eligible for Head Start. Another question is prioritization between families who are involved with the campus and families from the nearby community. There's no right or wrong answer to that, but there is going to be a difference in opinions, and based on kind of what the needs are in the area will show how important it is or is not to ensure that there are spaces for community members or reserving spaces for families that are involved in the campus. So we've got a whole, I think it's 2 or 3 pages here of these big topics that are going to be big discussion points and things that are going to work through. And we've highlighted some of the pros and cons of going each way, what some of the options are to help colleges and Head Starts as they talk together to figure out what their answers are going to be to each of these. So next. We've also got, just to be helpful, a ginormous big checklist of things that should be included in the MOU and contract when it comes time to actually put pen to paper. There's going to need to be kind of legal counsel involved in all of that, so we can't do the entire piece for everyone. But there are lots of decisions that need to be made in addition to all of the things that were just discussed on the last slide with the negotiation topics and on those resources. The eligibility and prioritization, you can put that in the MOU or in the contract, but everything down to things like key fobs and access to some of the other resources on campus, like allowing families to get access to the gym or the library or things like that. There are also things to be figured out and included in the MOU or contract around the running costs, because they're running costs for a building outside of just the kind of free or discounted rate for rent. But who's covering janitorial services, groundkeeping, phone and internet? So we've got this big list of things that will hopefully guide Head Starts, colleges, and everybody's legal counsel in developing their MOU when the time comes. And then finally, the last thing I will highlight is just a couple of resources we have around actually launching your partnership. Once the MOU is signed, once you've started to actually either break ground or get the doors kind of swung open and serving children and families, there are a couple other things in here like marketing materials and thinking about where you put those on campus, who should know about this partnership, both in different campus offices, but also off campus, to make sure families understand what's available and try to bring them in. And then we also have some guidance around working with other college departments. There's the really obvious connection between the early childhood academic department and hands-on practicum experience at the center. Helps, students who are looking to get their teaching degree, real-world experience in the classroom, gets hands-on deck for the program itself, and potential staff to hire as soon as they have their degree. But there are actually a lot of other opportunities that are really interesting and beneficial depending on what programs are available at the community college. Everything from nursing students and dental hygienists who can do some of the screenings, teeth cleanings, et cetera, all of that Head Start programs are bringing for children, but also over into like the construction and trade programs. We heard a great example from someone who had all of those programs helping build a new center. So their students who were in these certificate programs were getting hands-on experience building a building, doing the plumbing and the HVAC and all of those pieces. And the Head Start was paying for the materials, but getting free labor as the students were getting this practical experience. So whether it's building a new building or kind of doing upgrades, or when things break, calling in some of the experts, there's a lot of kind of potential partnerships there between the Head Start and the college beyond just the early childhood piece. So we've thrown a lot at you. There's a whole lot in there, as you'll see. It's a 50+ page user guide at the moment, but there is much, much more to come. We have so many additional ideas, suggestions, pieces we want to pull together as resources for phase 2 as we move forward. And so with that, I will pass it back to my colleagues to tell you what is phase 2, what is next, and what's more.
Thank you so much, Victoria, as well as to Sean and Steve for that overview. If you haven't checked the chat, I do have the URL for the Kids on Campus homepage on the ACCT website. You can download the user guide by using that chat button. So what's next is that right now, ACCT and NHSA both have surveys in the field to start gathering information for community colleges and Head Start programs who are interested in exploring a partnership or being paired. It is our goal, and you'll see the launch date of February 2024 there. It is our goal to start exploring community college and Head Start pairings. We expect to start with a very large number, hundreds and hundreds of pairings, and then with the goal of getting 75 partnerships opened and up and running. But it is, it is possible it could be a much larger number than that, depending on how it moves forward. But we do expect that some pairings may decide that they need to wait a year or two before it's the right time, etc. And so, as I alluded, our formal launch date goal, please note the word goal, is February 2024. So please fill out the survey. There's also an interest form on the website. We're trying to build as large of an outreach list as possible. We are looking forward to hearing thoughts and reactions to the resources that we're publishing this week over the coming months. As Victoria mentioned, we have so many ideas of what we could add. I think if we had, another month or two, this could have probably easily been a 100-page document. We kept thinking of more things that we wanted to do, so we had to start keeping a list of, okay, what are the next set of materials to come. For example, one of the questions in the Q&A was about braided funding. You heard Victoria mention that, and you'll see it in some of the profiles as well, that frequently Head Start is either the backbone or one classroom of many. So, that's just one example where there's much more to explore. San Antonio College in Texas, for example, has both Head Start and C Campus and private pay students all in the same place. So there really are a lot of options for how to do this. And I think that theme that Victoria said of there isn't right or wrong answers, but it's what each partner needs and what the other partner is able to provide, and trying to help match those needs together. So with that, we will turn to question and answer, as well as contact information. So you can see all of our email addresses here. I have had to help who to reach out to, especially if your question might not directly relate to any of the topics covered today. We would ask Head Start programs to reach out to Victoria, community colleges to reach out to Sean. Any funders who are on the call who are interested in talking more should reach out to Steve. And any of our government friends. We've had many conversations, I think, with about 8 agencies, several congressional offices, and some state offices as well. So any of those can come my way. In addition to the link in the chat, this QR code will also take you to the URL directly. So lots of options for you to be able to bookmark and download the resources. And so with that, I see some questions that are coming in. So let's start with Victoria. Will the new partnerships include expansion of current Head Starts or only new Head Start programs?
So the idea is that we're going with existing Head Start programs who are looking for additional space. Especially free space if you're getting kicked out perhaps of one of your elementary school locations as they expand, or if you're just looking for a new center location that will be more accessible and more supported kind of for your families. This is a great opportunity for it. The other piece we're thinking about is whether it's kind of shifting existing slots or expanding and bringing in new slots. And for now, we know the easiest thing to do is just if you're moving slots around, say closing down a center or decreasing by a classroom or two and moving those elsewhere. But also talking to the Office of Head Start, thinking about if there are opportunities to ensure that for Head Start programs that love all the slots they have exactly where they are, but are interested in expanding and serving more children and thus need more funding, that perhaps that could be available in the future as well.
Thank you, Victoria. Steve, I'm gonna send this next one to you. Can the site be immediately across the street from the campus, or does it have to be on campus?
You would give me the hard one. I don't know that we've determined that. I mean, I think one of the benefits of the co-location is removing additional barriers like transportation, and then also having access to the students, and having those additional partnerships or engagements on campus. So I wouldn't say we would rule that out. I think it also depends on, when you say across the street, is that an existing Head Start across the street, or is that, like as Victoria mentioned, they are being asked to leave their current location and they need to find a new location? I think if the new location happened to be across the street and it met all the parameters, I don't see why a partnership couldn't exist. But I think our goal is to take Head Starts that are looking for space and provide that 20% match from the space allocation. So that's I guess to be determined. We haven't run across that yet. So that will definitely, I'm glad you brought it up though. I think that's going to be on our radar now.
Yeah. And I think it's that idea that the community colleges are able to give free or discounted rent that Head Starts can use towards their match. That is really where the is it on campus or across the street comes into play. If it's the child care center across the street operated by a faith-based organization who's also willing to give that free or low-cost rent, then the Head Start's getting the same benefit. But if it's in a corporate office building, they may not be as willing to make the deal on rent, so that might just seem less attractive. I had someone follow up. I misinterpreted one of the questions. It's about whether the partnerships are new or expansion. So I mentioned there are about 100 partnerships already. We hope to continue to draw on their experience, but the goal of this project is to create new partnerships where they do not currently exist. However, it is not to apply for new Head Start grants. It's to work with partners who already are part of the Head Start system. And one thing that I will share that I did not know before I started this project is that Head Start grants, usually one grant encompasses many, many Head Start locations. So to think about that grant a little more like a school, like a Head Start grant is a little more like a school district, not a single elementary school. And so what we are hoping is to be able to reallocate those seats. And I saw Victoria come off mute, so let me see what Victoria wants to add to that.
Yeah, I realized I responded to Allison in the Q&A, which probably moved it off your screen before you could see it. So in particular, Allison was following up with the idea of they're a college with 5 different campuses and have a Head Start on one campus, but looking to add to another. And I think we would love for that to be a part of this. We were thinking about that as well. What do we count as a new partnership? And really the idea of making sure that there are classrooms and support for childcare on campuses where parents are actually taking classes. Steve used to work at a program in the Baltimore area that had 3 campuses that all used to have childcare centers and 2 closed down. And, what does that look like for somebody who's on one of those 2 campuses and has a child that needs childcare? So I think we would count that and bring that in as part of our partnership, because even if it's the same organization, right, it's the same college and just a different campus, there's still so many things to be worked through there. So nice to know that, you know, overall leadership would probably still be very supportive and understanding of what's going on, but a lot of negotiations still to be had, a lot to figure out when it comes to what buildings are available, how things are going to work exactly.
Thanks. Sure. I'm just going to add one thing along those lines. And, you know, because these partnerships, like what determines a partnership and what does that look like? I was recently at Long Beach City Community College, and they have child development centers on campus, but they do not have any Head Start locations. However, they do have two rooms that are licensed for what would be considered early Head Start. So when we're talking about, like, is it a full-blown Head Start? Is it early Head Start? It could be one, both, either or. So, you know, they might be able to participate in this project to add the early Head Start piece as on their campus, and then have child, you know, resource centers from infant all the way through post, you know, after school care type stuff. So it can look a lot different depending on the situation.
We have a question about what type of funding is available. Victoria, I see you're typing. Do you want to share that for everyone? Because I am sure that's on multiple minds.
Yes. So our big thought with this project overall is that this can be done without significant additional pots of funding, that there's space and resources available on the community college side. And then Head Start actually has the Head Start funding to be running the program. So there is a little work, obviously, that has to be done with the negotiations. But if you're just relocating slots and opening them in a new space, we're not seeing that as something that needs a significant amount of funding. When it comes to whether you want to obtain additional slots, then you have to start getting into the Office of Head Start and additional grants. And so that's a whole new piece of it. But does that answer the question?
Susan, if you can let us know if that answers your question, but maybe Victoria, as part of that, do you want to talk about the 1303 funds?
Yes, so there is, Head Starts do have funding that they're able to use for buildings and renovations and things like that. There are some pretty, at times, complex rules around that, and that's the federal interest kind of topic that we have in there. A lot of Head Start programs prefer to not use, I think the limit is $250,000. And if you put in construction, kind of major renovations, those types of things, if you put more than $250,000 of federal money into a building, then the federal government starts to have an ownership interest in the building, which is not something we want to get to, especially for buildings on community college campuses. But there are other ways to kind of structure those payments and how it's covered. So we see it really possible to use Head Start funding to make some of that happen, but there are really specific ways that needs to be done. We have some guidance in there. We want to establish much more guidance and resources in phase 2. As we tap into some of the real experts on the 1303 process and the Head Start slide.
Thank you, Victoria. And I'm seeing some specific follow-ups from Susan and Allison. So I think these are pieces that, as we work with each partnership, we can determine what that navigation looks like. But I want to make sure I get back to the question about what matching actually entails, and whether whether there is funding supports or whether this is a warm handoff or introduction. I think it's in between. The TA, technical assistance, is where we're really focused here. So for the matching, the first step is expressing interest in being matched. The next step is us finding a community college and a Head Start that are geographically convenient, where it makes sense to start having these conversations. Then we are developing a fuller screening process to help measure the readiness of the two partners to form a partnership. So for this particular project, as one of the commenters said, their Head Start is out of slots. So one of the questions on the screener will be, is the Head Start either looking for a new location, or do they have current slots that are being unused? that they are looking to reallocate somewhere where there is need. So that's one of the measures of readiness that we're looking for in this partnership. If the Head Start is full of slots, then I think it's a separate set of services that are really needed to help expand that specific Head Start grant. And then once a college and a Head Start seem ready, according to our screener, and they've started meeting, then we are hoping to have team members who will be able to walk them through a technical assistance process, figuring out what space needs retrofitted, figuring out the legal, helping support with sample MOUs and conversations with general counsel about what the contracts look like, helping determine what schedule alignment or changes may be needed, those sorts of things that ultimately we hope will end with the signing of a contract and the launch of a center. So we do expect it to be TA. While I say hoping, is that we are, candidly in that fundraising process now, and that's why we're setting the goal of launching this next phase of the work in February of 2024, because we will know by then the level and the robustness of services that we're able to provide and our exact working plan, depending on how those additional resources to fund this project come in. So that's where I will go there. Let's move. I saw a question in here about data. Yes, Steve, with these new partnerships, what will evaluation and data collection look like? Actually, and Victoria is our in-house data, so probably for both of you, what will this look like? I will start before I turn it over to Steve and Victoria for specifics. I will just comment, especially for those of you who maybe attended our spring webinar or have had some earlier conversations, that we started this with the idea of one type of evaluation in mind. We have shifted that based on what we expect to be the number of student parents with children participating. So we will have data collection, we will have storytelling collection. We are looking to do an annual report in addition to, blog posts and webinars and things like that, sharing our findings. But the being realistic about what data we can collect and how we can share it is one of the things that we've been sorting through as we apply for this next funding round. So with that, let me turn it over to Steve and Victoria to talk about some more of the specifics.
Victoria, do you want to start?
Sure. We're not starting off with an RCT or anything kind of too complicated like that, but we are looking towards some kind of data collection on both the college and Head Start side to really understand who's being served and what impact we're having in terms of getting parents into school, persisting throughout their degrees, bringing new families into the community, etc. So we are going to ask some of those things of our partners, but there will be some support, financial on our side to the programs for participating in that, and some support from hopefully staff on our side to be tracking that.
I think a couple of other things that we're looking for is, one of the reasons we wanted to do this project is, understand, like, is this a good business model for the partnerships? Like, does this make sense? Is it financially feasible? What is the actual appetite for these types of partnerships, which we've seen initial interest like through the roof, which has been amazing. What are the benefits of these? Victoria mentioned data on student parents. So I think a lot of community colleges don't have a good way to collect information on their current student parents. And so we're hoping that this implementing these data collection systems will help kind of spark that, okay, we can just scale this, and not just Head Start parents, but then also all of the their entire student body to get a better picture of who's actually on their campus. So those are some of the other things, and Victoria mentioned persistence, completion, who's using this, what other financial resources are they receiving, those types of initial data points. And I think, as the project moves along and starts to scale and we get more and more of this information, we can start to dig a little bit deeper and disaggregate some of the information that we're going to collect.
Thank you, Steve. I see one last question in the queue for now. So if you still have a question, please type it in the Q&A box before we wrap up. But before we close, I think we will cover this next one. We probably have time for one or two after that, if anyone still has any additional questions they'd like to ask. So this one, is there a geographic component? I recall some conversations when this was first announced that existing Head Start programs had to be over a certain distance from the college. Victoria, let me throw that one to you.
So I don't think there's anything around specific distance from or closeness to the college. It's more about service areas or catchment areas. Can you guys hear me? Is my Wi-Fi going?
No, you're okay.
Okay, then it's just on my side. Yeah, so Head Start programs are essentially, they get their grants to serve a certain area. So it might be a couple counties, for example, and they can really serve, they can have their centers anywhere within that area, and they can serve families that live anywhere within that area. It's not guaranteed that they'll align with the catchment area of the community college, but there is some flexibilities there that are possible, and a lot of potential. We think that it'll be okay to, relocate within a certain small area.
Thank you, Victoria. And I see we have a follow-up here on the data and evaluation about doing a randomized control trial. Susanna, that is definitely where we started in this conversation. But one of the things that we realized as we started working through the timeline is that if our goal is to open slots on campus for college students who aren't currently participating in Head Start, that the time frame to get the partnership established, open the center, enroll the students, and then follow those student parents through their program completion could possibly be longer than our window, or for those who did finish within our project window, that the number might not be large enough for us to have data that we can share. We did not want to go through that and then have all of our ends be suppressed for being too small. So we ironically haven't launched the second phase of this project yet, but are already talking about what the third phase would look like. And I think, on the third phase side, if we are successful in greatly increasing the number of partnerships, that then there has been a lot of interest in the RCT model and bringing both the current partnerships who are already operational, as well as the new partnerships that we create together to have a large enough aggregate group of college student parents that we could then track their outcomes. So certainly on our minds, we are, just want to make sure that we're setting up the evaluation in a way that it best reviews what we're doing for this project and then sets us up for future work as well. But that's definitely coming. So with that, I do not see any more questions, and we're just about right at the hour, so I'm going to wrap us up. Thank you again for everyone who joined today. We really appreciate your time, your interest, your questions, even questions that are finding holes in our proposal. This is, great learning for us as we go down this path, and we're really looking forward to continuing to work with both community colleges and Head Start, particularly at a time in our country where the childcare needs, and frequently, as you hear it referred to in the media, childcare access crisis, is becoming a greater and greater part of our national conversation. We believe that this is, one way to start looking at solutions. We'll need several for all of the different groups of parents nationwide, but this is the place where Head Start and community colleges can come together. So thank you to Sean and Steve and Victoria for your presentations today, and also your hard work over the last 6 months bringing all of these resources together. Thank you to Amber and Abigail for making this possible through your foundations. And we look forward to continuing these conversations and to being in touch with all of you, if not immediately following up this webinar with resources, and then in the new year as we start to roll out instructions for the next step. Thanks again. Have a good day.